Hello, here are some PPE concepts. All right, first, regular clinic gloves, okay, they're non-sterile. Put them on, do whatever procedure or thing that you're gonna do. And when you're done, this is the way to take it off without contaminating your hand. So touching only the outside of the glove, pull it up slightly so you're exposing some of your palm, and then also touching only the outside of the glove. Invert this glove completely and scrunch it up with this hand. Now take your thumb or finger, put it in the clean inside of the glove, invert this as well, and then you're left holding the clean part. So you throw that away and then you wash your hands. All right, when it comes to doing sterile glove procedures, just to show you guys real quick. So this is the packaging comes in. You open it like this. To keep it open, I sometimes fold down the bottom. So now this is all going to touch your skin, okay? So you can touch this part. You cannot touch this part because it's the sterile part. So to start with, you pick one up and you can touch this. So I would just put it on kind of like this. You can leave this part folded up. You don't have to fold it down. Now, when you take the second glove, what you do is slide. So this is sterile and this is sterile. So you can touch it, slide underneath this little fold right here, and then kind of, and you kind of feed it to your hand. So it looks like this. And then you wrap it over. And then you can touch it if you need to. Oh gosh. Oh no. It's all right. Done. Boom. Now you can fold that part down. You're done. Same way to take it off. If you're not wearing any other protective gear, go like this. You can dispose of this one and dispose of it like that. All right. What time are we at here? Okay, great. So next will be the mask. Very easy, but you want to make sure that you're not exposing yourself to further droplets or respiratory stuff, which I talked about in my PowerPoint. So when you put it on, simple like this, pull it like this. Make sure you adjust the nose strap. Some people have been to increase their protection. They're putting like strips of tape and things like that. But for your guys' purposes, this is enough. So you have this now. Don't touch it anymore. So you're going to go see patients. You're going to wash your hands. You don't have enough masks in between. You can't change it. Don't touch it anymore. This is contamination. Like this is contamination. This, walking around like this is contamination, okay? So to make sure you guys are minimizing your own exposure and other people's exposure, don't touch it anymore. You put it on, you're done. When it's time to throw it out, start from the back, unhook it, never touch the outside of the mask. It's now considered contaminated. And just throw it away. All right. And the last part would be if you were putting on a gown. So kind of similar concept. Let's pretend this is a disposable gown. So it attaches in the back. So you're putting it on like this, putting the sleeves on like so. When you're done, you tie it, blah, blah, you do your procedure. Sometimes you put your gloves on outside of it. And I should have prepped this before. All right. Well, that is, hold on a second here. Setting up this video. Okay, great. So gloves, gown, you want to make sure all your wrists are not exposed, everything's covered up, the gloves are going over the gown. And when you're done, you break the seal in the back, not by untying it and touching back here, but pulling from here, because all of this is exposed and contaminated, okay? So you pull, and when this is off, you want to make sure that your gloves are coming off with it. So all this is dirty, so you can touch this, pull it off, and when you get to this part, same thing, put your hand underneath that glove and peel it off with the rest of the gown, and you throw it all away. Okay, good job, guys. That's all.